We know that the pandemic has brought on a national mental health crisis in children and teens. We are here with Dr. Heidi Rawlings of Pine Rest Christian Mental Health Services. And in what ways has COVID really had an impact on young people?
Yeah, well, it's certainly impacted a lot for youth and their families. Their daily routines are getting thrown off quite a bit. They might be experiencing irregular school times, difficulties with maintaining good sleep hygiene. Their social experiences are certainly disrupted by this. They're not getting to talk with family and friends or people who are more distant perhaps from them than they normally would experience. And then some teens are missing out on normal milestones that we would expect that they're not able to do during the pandemic. For example, I've talked with someone who wasn't able to attend a graduation. There have been changes in how they receive health care as well. Some have missed appointments because they were needing to be rescheduled, or they've changed from being in person to over telehealth, which certainly has thrown a wrench in their plans.
And what kind of things have you seen when you are meeting with children and teens?
Yes, well, we see some people just struggling with how to cope with the stressors that the pandemic are bringing on. We also see some people presenting with more depression and anxiety that's on the rise for teens. And then for some who are especially struggling to cope, they might be experiencing self-harm or even thoughts about not wanting to live.
And a few key symptoms?
Sure, well, low mood, changes in appetite, changes in sleep, and then not finding as much joy or engagement and things that they typically would are big signs to be concerned about.